Traveling is done. Welcome to our coaching chat Zoom. We are in a series right now that we are honing in on various diseases. And then what we're doing is taking a look at the research that's been done on Juice Plus and really arming ourselves up and knowing what tools are out there to share with other people. And so we've done anti-aging, we have done cancer and autoimmune disease. And so if you're not familiar with our Team Extreme website, make sure there's a link on Team Extreme Facebook under the saved settings that tells you how to get there. We'll show you at the end of the call, but just knowing we have a place, a library where we're putting all this documentation, videos, and information. This is for us anytime we're talking to people, knowing we have this toolbox at our fingertips. Y'all, let's utilize it and make the best of it. So today our topic is cardiovascular health. And so we're going to go in, we're going to kind of look and see what's there, talk about some of the research, and then I'm going to turn it over to Brenda, and she has found a fabulous video that I think we all need to send out to customers and have ready to go to prospects. So let's jump into, let me move back over here. I apologize. I should have been more prepared. Okay, so this is our, let me get all the way back out. So this is our Team Extreme website. And as you can see, once you get in it, teamextreme.dropmark.com. And once you're in there, all of this information that we're working from is under the tools section. And then as you can see here are the ones we're just trying to build a library, and today is cardiac. So I'm going to jump first thing in. Well, let me kind of show you what's in here. So, and we're going to come back to, these are talking points. You know, if just having this available to really kind of get in our head so that as we're talking to people, we can make that connection between taking Juice Plus and the impact that has on our cardiovascular health. We have 4 research studies, and there's 1, 2, sorry, these things kind of pop around, 3, 4, that specifically deal, and we're going to talk a little bit about them today. So get a pencil and paper out so that you can capture some of that verbiage. So coming here, printing it out, I literally am keeping this in a verbiage notebook so that as I'm talking to people, what I know their issues are, I literally can flip over to my cardiovascular section and really have things highlighted that I can share until I kind of get them secure in my head. Today, we're going to listen to this. Brenda, I have not listened to this. Brenda says it is amazing. So we want to make sure you got a notepad to take notes from that. But let's kind of look at a couple of quick videos so that you know what's here. These are these like 1 or 2 minute videos that you can quickly send to people. And so we're going to start with this one, and so that you know what's here, it'll jog your memory when you're ready to talk to somebody.
Starting the road to good health can start at any age. It can start when you're 6, 8, even in your 60s, 70s, and 80s. And we know that a lot of adults and even seniors are malnourished. And when we're talking about people as they get older, we're dealing with various issues that are preventable by proper nutrition. It's an integral part. So as a cardiologist, I do recommend proper nutrition to my patients. Juice Plus provides that. Juice Plus provides the phytonutrients that come from fruits and vegetables and from berries. Our body is a dynamic process. things are happening and the body's breaking down daily. We can slow down the progression of that with proper nutrition. Good nutrition is a integral part of cardiovascular disease prevention. And Juice Plus is a great partner to collaborate with regards to good health.
Just a quick video to kind of perk somebody's interest. Here's another short one.
Even being young, you realize that prevention certainly starts now. My dad's dad died when he was 43 of a heart attack. And I think so much of that can be prevented with good nutrition, and people underestimate the power of good nutrition.
In the stresses and the fast pace of life, it's very easy to go for the convenient fast food. Well, there's nothing more convenient than fruits and vegetables.
When you take Juice Plus, you just desire more fruits and vegetables. And because of my age, I knew I needed to make some changes in my body and my arteries, that type of thing.
My favorite product, I'd have to say, is the Vineyard Blend. Because I have a long family history of heart disease, I understood the research behind it. And that's the one study, actually, the Journal of American College of Cardiology, that I share a lot with people. Anybody who's under stress, I just think it's a great product, and I'm glad that I started it.
I thought I was pretty healthy. And when I had that heart attack, I didn't have any health problems that I knew of, but obviously I had one. And ever since, I have been cognizant of eating better and have not missed a day taking my Juice Plus. And I know what it's done for my health.
As a nurse, I've learned when people have illnesses or injuries, very often they are not given a second chance. And with Juice Plus, you have that second chance to be healthier.
It just made sense. 20 to 30 fruits and vegetables, solid nutrition, densely packed nutrition into my diet on a daily basis. So for me, making that one simple change, putting my health first and choosing Juice Plus has made all the difference in the world.
All right, I'm going to show you one more. These are the little short ones. This one to me is the Dr. Talzer, who is the first surgeon ever to do surgery on a baby still in the womb. So to know that we have someone at that caliber recommending
Well,
Juice
there are
Plus.
some alarming figures.
Heart surgery.
Chronic diseases in childhood appearing even earlier now, especially cardiovascular disease, things like increased blood pressure or hardening of the arteries. Through research, we are realizing now more and more how important a role nutrition really plays in this. And I try to explain to my patients and their parents each day how important nutrition really is. Their cardiovascular system is at risk, and now is the time to protect it as well as they can. Nutrition is the most important thing. It's the thing they can change. It's easy for me to recommend Juice Plus. There's so much scientific evidence behind this product, with all the peer-reviewed, with all the scientific studies published in peer-reviewed journals. Juice Plus is a product that's useful, it's safe, and through research we know exactly what it does to our bodies.
All right, that one is another great one that when just talking to people in regard to cardiovascular health, it is still the #1 disease that takes people out. And so it doesn't matter who we're talking to. Everyone is concerned about keeping their cholesterol down. One of the things that I started doing was just really printing off at least the summary of the research that we've done in regard to cardiovascular health. So I went to my landing page, went to the research, went down to cardiovascular health, and there are 4 different studies that are specific to cardiovascular disease. And so this first one is the encapsulation. Let me find it. So this first one here is talking about pulmonary function and cardiovascular risk factors. And what was really kind of stood out to me is of the 4 studies that they had associated with cardiovascular disease, 3 of the 4, they also tested smokers, because smokers invariably score much worse than someone who is a non-smoker. And for them to go after a smoker to see what kind of impact it's going to have on them. And it was amazing when I started reading this research. So the first one here is about pulmonary function. And my dad died of a heart attack and dealt with cardiovascular issues for many years. And so the lungs and the heart are so connected that you're looking at both. Like if someone's having a hard time breathing, you want to check their cardiovascular, what's going on, because a lot of times they go hand in hand. Well, this study showed that respiratory function in the placebo group had no change. The fruit and vegetable saw some improvement in both their pulmonary function as well as cardiovascular function. But when they added the berry blend, it went from improvement to significant improvement. And I think that to me is, if we have people who are not taking at a minimum of the trio, we have to talk about how that berry blend really takes it to a whole nother level when it comes to cardiovascular wellness. And it says a significant improvement in both airflow. It increased it by 25%, as well as their capacity, how much air they could keep in their lungs, as well as from a cardiovascular standpoint. And so I think, to me, if we're trying to help someone go from a duo to a trio, print off this research and talk about that with them. The next one over here is the effects of encapsulated fruit and vegetable powder concentrates on oxidative status. And again, it looks at both smokers and non-smokers. And here on this one here are the 3 points that you want to kind of glean and refer back to this research. Significant decrease in cholesterol. I don't know if anybody on here takes cholesterol medication or knows someone who has, but I know that they put my dad on cholesterol medication when he had an open heart surgery. His cholesterol wasn't even high, but that was just what they did. And I didn't know that they had done that. And suddenly my dad, like his legs began, like he started like almost falling. It decreases the muscles in your body taking a cholesterol medication, to the point he literally started having to use a cane. And I don't know why, but I said, let me look at what medications. And when I saw that they were giving him cholesterol medication, he got off of it. And believe it or not, over a few months after that, the muscle weakness went away. So, keeping our cholesterol in check through fruits and vegetables versus trying to do that with a cholesterol medication, there's always side effects when it comes to medication. And so, the second thing from this was an increase says BMDA, which I didn't know what that was. And when I looked it up, it's a derivative of garlic that protects against lung cancer. And so there's garlic in the berry blend. And so I guess, when you think about the berry blend and just the little bit of garlic put into it, yet it had a dramatic impact on protecting against lung cancer. And I thought that was pretty interesting that was actually in the cardiovascular study. And what it was a reminder to me that unlike medication that's like specific to one thing, fruits and vegetables cover a broad range of protection for our bodies. And then the last thing that was discovered in this research was a significant decrease in oxidative stress, which goes back to, I love Dr. Du Bois's point, all disease tracks back to inflammation or oxidation. So that research study was both on healthy individuals and on smokers, and they both, even though their baseline was different, they both had the same amount of increase in protection, which is almost unheard of, that a smoker would get the same kind of bump. This one here, the 4-week supplementation, 4 weeks of adding Juice Plus to someone's diet. So here was what came about of this study. So 28 days, smokers and non-smokers, again, which keeps surprising me that they went after both to see if both will get the same kind of bump. Increased beta carotene, lycopene, alpha tocopherol, and folic acid. So those are those nutrients that our body needs to really protect when it comes to cardiovascular disease. Number 3, it decreased homocysteine and oxidative stress. And if y'all remember, homocysteine is really what they measure your longevity for any disease, your protection of any disease. So the lower your homocysteine levels, the healthier you are. And so within 28 days to see your homocysteine levels drop, as well as oxidative stress, y'all, as I read this, it got me excited. And it also made me think, I wonder what my health would be like if I weren't taking Juice Plus. When you see all these shifts in all these different studies, a shift, a decrease here, an increase here, what would my health be like? For 20, I guess I'm on 28 years now of getting Juice Plus in my body every day. Number 4, what came out of this study was that how it was the fruit and vegetables in Juice Plus are highly bioavailable. Was it you, Brenda, that was telling me or did I hear this, that just regular multivitamins have absolutely no impact on cardiovascular disease. But yet we know fruits and vegetables, our body knows what to do with them. The 5th thing were antioxidants were highly elevated. So we know it's getting into our bloodstream. And then lastly, decrease of risk of any disease. That's huge. Back to fruits and vegetables. It's such a broad spectrum that it doesn't really matter the disease. You take fruits and vegetables, you're going to get some positive results. And then the last one is this study here on systemic blood pressure progression, coronary artery calcium. And this was a 2-year study. So this is a long study. 4 things that came out of it, both systolic, can't say that very well, and diastolic blood pressure decrease significantly. Wow. How many people out there on blood pressure medication that maybe don't have to be if they just got the nutrition in their body? And I've personally seen that in my own testimony is seeing, I remember when I started, I was in my early 30s and I thought, oh, well, it wasn't my blood pressure, it was my cholesterol. It was right at 100 and I thought, okay, it's at 100 or at 200. And looking back now, I'm like, that's not what we want, just because it's barely under the threshold. And I remember after being on Juice Plus seeing a significant drop in my cholesterol, and so as well as blood pressure. And then the second thing is artery compliance improved significantly, so that our arteries and the lining and the what do I want to say? Just the value of our endothelia, our arteries continuing to be more pliable, clearing them out. That's what we want. You know, not only to prevent heart attacks, strokes, that kind of thing, but also that delivers the nutrition throughout our body through the endothelia, the better it is. I just remember Dr. Bill Sears talking about, we have the ability within our system, if we give our bodies the right building blocks, it knows what to do. And he was talking about keeping our endothelia cleared out so that that nutrition can circulate throughout our body. Number 3, this research study decreased in homocysteine and cholesterol, back to the same. So we've got different places doing research on Juice Plus, both coming back with the very same outcome. Reduces your homocysteine. That is reducing your chances of disease, any disease across the board, the lower our homocysteine levels are. And then lastly, increase in folate, which, as we know, is a huge nutrient that's highly connected to cardiovascular health. So you guys, we have the research. It's what stands apart. It took me 20 minutes maybe to read through these 4 studies. Now I've got them highlighted. I've got my notes all over it. I'm going to put it in my verbiage notebook. And so when I'm talking to someone in cardiovascular, asking people, what's in your family history? And my dad has both cancer and cardiovascular issues. And so, asking people that question, what does your family struggle with? I remember 2 weeks ago when we did autoimmune disease, and Karen and I were having a conversation, and Karen was like, looking back, she made the comment that she felt like, I think her dad and maybe even her grandfather, she said, looking back, that she was pretty sure they probably had an autoimmune disease. And I think getting people, as we're having conversation, asking questions and hearing what their hot points are, what their triggers are, what they're susceptible to. And then and I'm going to keep encouraging us all to have a verbiage notebook. And I would literally have it separated by different diseases so that instantly when we're talking to people, if we're, at home, where we can flip and look at it. And then over time, those talking points are just going to come out of our mouth and think. And back to, and I'm going to hand this off to Brenda. Y'all, let's get in a habit of listening to at least one video a week. At least one, preferably more, but at least one. And here's why. A couple things is, before you know it, that verbiage is going to pop out of your mouth and you're going to be like, dang, that was pretty good. Where did that come from? It's because it's getting in there. So number 1, so that it automatically comes out when we're having conversations with people. But number 2, and it was so funny, Brenda and I were going back and forth based on what I was reading on the research. Brenda was looking at the videos, and we both were so excited. We were kind of talking over each other about what we had discovered. We're building our own belief. And as we build our belief, we can't help but share that. People are going to hear it in our voice. They're going to hear it in the words we're saying. They're going to see it in our facial expression. They're going to hear that excitement. And building, I think, and I'm going to be honest, this IT shift has probably shook us all. I know it shook me. I hate to admit it, but it has. So how do I rebuild that belief? It's getting back in and reading the research, listening to the videos, reminding ourselves, regardless if the mechanics are messed up right now, we have a product that is untouchable. Nobody can come close. Nobody even has research to prove that their product does anything. And we have the research to prove what it does in our body. And so of all times, now is the time for us really to roll up our sleeves, dig in, and really get this stuff in our brain, in our hearts, so that as we talk to people, they will hear our excitement and they're going to want what we have to share. So Brenda, I'm going to toss it over to you and let you, I can't wait to watch this video. So get your pens and papers handy and let's start.
Do you need
Really,
to stop the share?
you should be able to.
Okay, great. Here we go. Okay, I am, like Elaine said, I watched this straight through twice last night. Everybody I've talked to in the last 24 hours has heard about this. So this is Dr. Eric Golder. This was done a couple of years ago. He and his wife, who is a dental expert, they just talk about the relationship between that. He'll go into it, but this one has more facts in it than anything I've ever seen, and more encouraging facts.
To make heart attacks optional. Want to join us in our mission, which is helping to knock cardiovascular disease off that top rung of the ladder where it's been as the leading killer in this country for the past 100 years. We want to help you take healthy back. So what are the statistics of heart attacks and strokes? So heart attacks remain the number one killer in this country, as they have been since 1919. Someone has a heart attack every 40 seconds in our country. Someone dies from a heart attack every minute. The average age for a man for a heart attack is 65, and for a woman is 72. So just when you get to that point in life where you're going to kick back a little bit, relax, spend more time with the kids and grandchildren, travel, get struck down by a heart attack or a stroke. The median survival for men having the first heart attack over the age of 45 is only 8.5 years, and for women it's only 5.5 years. It's the largest cause of premature loss of life. That's an average of 17 years. So what about strokes? It's very similar to heart attacks. It's the leading cause of disability in this country. Somebody has a stroke every 40 seconds. Somebody dies from a stroke every 4 minutes. Over 2,300 people in this country die from cardiovascular disease every day. And if you've ever been to Washington, D.C. and seen the Vietnam Memorial Wall, you know there's 58,000 men and women on that wall. And every 3.5 weeks, 58,000 people in this country die from cardiovascular disease. Every 3.5 weeks, we go through a Vietnam War worth of death, and then we do it again. So what are the classic risk factors for cardiovascular disease? Well, you know these: it's high blood pressure, diabetes, cholesterol, tobacco smoking. And these were all developed from the Framingham study that we're going to talk about a little bit later. But if we just take one of these risk factors, and that's diabetes and obesity, and look at what's happened to this country over the past 20 years. These are CDC slides of obesity and diabetes by state in this country, and we're going to click through these maps very quickly. You can see that we're going from relatively healthy to relatively sick very quickly in this country. Over the next 20 years, we're almost there. Now that's 2014, here's 2015. And if you compare this slide now to where the deaths occur in this country, or compare it to the beginning slide, you can see that we've gone from being relatively healthy to relatively sick, and a great deal more diabetes in this country. The CDC map by county of where deaths occur in this country by cardiovascular disease is very similar to the bottom slides. So we know that Juice Plus improves insulin resistance. There's a CDC report out that states that there are 28.5 million people in this country with diabetes who know it and are being treated. There are another 100 million people in this country who either have insulin resistance or diabetes, don't know it, and it's not being treated. 100 million people, that's almost a third of the country, has either insulin resistance or diabetes. So a heart attack or sudden cardiac death is the presentation for half the cases of coronary disease. Really, the lucky people are the ones that get symptoms or see their doctor and get a stress test done and find out they've got a problem and get treated for it. The other half of the cases, it's either a heart attack or just dropping over dead. So here's several people that we all know. David Letterman, the old Tonight Show host, had a heart attack and five vessel bypass surgery. He was only 52 years old. James Gandolfini, the lead actor of The Sopranos, had a heart attack and died at age 52. John Candy, the comedian in many films, and had a heart attack and died at age 43. Bob Harper, the celebrity personal trainer, had a heart attack at age 52. And here's probably the most ironic of the bunch, Dr. John Warner. He's the immediate past president of the American Heart Association. He was at the big American Heart Association annual meeting in November a couple of years ago. And he came back up from his spin class at 6:30 in the morning and dropped over dead in the hotel room. Fortunately, his family was there. His daughter had been trained in some non-breathing CPR. and he got resuscitated and survived. We're going to talk about him a little bit more toward the end of this talk. So that begs the question, why do people not know that they have arterial disease? All these people had arterial disease. They had it for years before they had an event, and nobody knew. Well, here's what a normal coronary artery looks like. It's got a thin, one cell thick lining layer here called the endothelium. And this is not, we used to think it was just a lining layer, but it actually plays an active role in controlling blood flow to your arteries. There's another thin layer here called the endothelium. Okay. Start right there. I'm good. Okay. There's another thin layer right here called the intima. This is where all the bad things happen in the artery. And then there's a muscle layer, and then the outer arterial wall, which is fibrous connective tissue and elastic tissue. And so if we look at a picture of what goes on in the arteries, this crusty old blockage, all this stuff here, this is all calcification, scarring, fibrosis, collagen, all this stuff happened in this thin little layer right here. And this is about an 80% blockage. This is all that's left of what we call the lumen, or the opening where the blood flow goes through. And this is a very stable blockage. It's probably not going to go anywhere. Nothing bad's going to happen to it probably. On the other hand, this blockage over here is probably about 25% blockage of this arterial wall. There's no calcification here. This is all full of cholesterol and the inflammatory response to the cholesterol getting into that lining layer, which is white blood cells and proteolytic enzymes that can dissolve proteins and kill bacteria. And it's just covered by this thin fibrous cap right here. Here's that blow up of that thin fibrous cap. And these proteins in here, these enzymes in here can dissolve this thin fibrous cap, and that's what can cause the artery to rupture. So the next question is, how bad is the blockage before a heart attack occurs? So this is a great study. It's a meta-analysis. So they took 4 smaller studies that were very similar in design, combined them to get a more powerful statistical result. And the question in this study was this: how bad is the blockage just before the heart attack occurs? So they got a bunch of people to volunteer to get a heart catheterization done every 2, 3, 4 years. And finally, when enough would come back into the heart attack and they looked back to see how bad that previous blockage was, they had enough information to publish a study. And what they found was 68% of the time, the blockage that was causing the heart attack was 50% or less. 86% of the time, the blockage that was causing the heart attack was 70% or less. So only 14% of the time was the blockage that was causing the heart attack bad enough to result in a positive stress test. The blockage has got to be about 70% before a stress test is going to become abnormal. 86% of the time, the blockage that caused the heart attack was so mild that a stress test would never pick it up. So Dr. Dean Berman, who was one of the developers of the radionuclear stress test, like a cardiolite thallium stress test, understood this when he said 20 years ago that patients who have normal imaging stress tests frequently have extensive atherosclerosis. What he meant by that was the flow through the artery on this axis only starts to drop off when the blockage gets to be about 65 to 70%. So what he said was a lot of people who have normal imaging stress tests frequently have 20, 30, 40, 50, 60% blockages that the stress test will never pick up. So 2/3 of the time, the blockage that results in a heart attack narrows the arterial lumen less than 50% over here, okay? It's not the blockage that causes the heart attack, it's the blood clot that forms when this thin fibrous cap ruptures and your body tries to heal it. And that blood clot then plugs up the entire artery and causes the heart attack or stroke. So how does the standard of care estimate your risk? Well, we rely on something called the Framingham risk score, or a cousin of it. There are many more risk scores out there now that are all based on a Framingham type risk. And they're looking at, it's based on a study started in Framingham, Massachusetts back in 1948, a little town of 5,200 people. Doctors from Boston went over there and did a history and physical, did blood work, did an EKG on every man, woman, and child in town, came back and did it every year, until finally about 10 years down the road, they had enough information, they could look at their statistics and found out that, yeah, it's high blood pressure. Those people having more heart attacks, people with high cholesterol having more heart attacks, smokers are having more heart attacks. And so this assumes, when you use this risk score, this assumes that you are the mean of some large bell-shaped curve. And you're not the mean of some large population group. You're your own group of one. And to treat you as an individual, we really need to know more about you, including something about your genetics. And so we want to know about you know, if you have 2 or 3 different genes that put you at increased risk for cardiovascular disease, there's a gene that we look at to see how you metabolize lipids, fats in your blood, because not everybody does the same. And that's important for our picking a diet for you, because not all diets are going to work for all people. And then we also need to, there are genes that we need to know about because they reflect how you respond to infections. And so if you listen to Dr. Barb McClatchy's talk, my wife's talk that she did about a month ago, she talked about that oral systemic connection and how your individual response to those infections can play a role in the development of heart disease. And so that's why we practice together, because we really need to know all about these different root causes that can play a role in both oral disease as well as cardiovascular disease. So then the next question is, how reliable is that Framingham risk score? Well, a doctor did a great little retrospective study. He took 222 people who came in with heart attacks, and they were people coming in prematurely. So as I said before, the average age for a man for a heart attack is 65. In this study, the men were less than 55. The average age for a woman for a heart attack is 72. In the study, they were 65 or less. And then after they came to the emergency room going, I definitely have arterial disease, I'm having a heart attack. He applied this Framingham type risk score and found out that it missed 82% of the women and 66% of the men. So these risk scores are not very reliable, and still the standard of care says, you know, guidelines handed down by the American College of Cardiology and American Heart Association says, do a Framingham style risk score and see what their risk is. So that's not a very good way to estimate your risk if we're missing that many people. So we're going to try detecting subclinical carotid or coronary artery disease to find quote unquote healthy people who are at increased risk if we find evidence of disease there. And that can certainly change how we're going to treat you. You know, if the Framingham risk score says you've got a 2, 3, 4% risk of having a problem, your doctor's probably going to tell you you're doing great and let you go. But if we find evidence of having disease, that's a totally different picture. So we need to look for disease. We know we can't use a stress test because it's often wrong for various reasons. We can do a heart catheterization on you. Well, that's invasive. There's risk of complications associated with it. And really the problem with both of these approaches is they're just looking for blockages that are bad enough to need fixing. They're looking for blockages that would require a stent or bypass surgery. They're not really looking for mild asymptomatic disease. So let's look somewhere else. Well, we can look in the carotid artery. It's right under the skin. It's right in your neck, right here. It's easy to image. And the anatomy is there's the common carotid artery down here. It branches just below the angle of your jaw here into the external carotid artery, which goes up the muscle of your face. Internal carotid artery then goes on up to your brain. And so we're going to use an ultrasound scan. It's called the carotid intima media thickness test. And it's just a simple 15 or 20-minute ultrasound. There's no needles, there's no contrast involved. It's safe, it's non-invasive, it's reliable, repeatable. The American Heart Association said all this 20 years ago, and still insurance does not pay for this test in this country. It's pretty inexpensive, but it's just silly that things are that far behind. So again, the CIMT is looking at the arterial lining. It's not looking at the flow. You remember the stress test that we talked about is totally dependent on the flow through the artery. We're not going to look at the flow. We're going to look at what's going on in the lining of your blood vessel. And so here's what it looks like. Here's in this picture, your feet are going to be down this way, your head's up this way. Here's the common carotid artery coming up your neck. At this line is widening out into what we call the carotid bulb, just before it branches right here into the external and internal carotid arteries. And we're going to look at two things. How thick is this lining layer down here in the common carotid artery? And there's a normal for age. It gets thicker as we get older. It's a little thicker in men than women. But if it's thicker than it should be, that's telling us that there's some cholesterol and inflammation building up in there. It's not plaque yet. The definition of plaque is a 1.3 millimeter thickness. And if you follow this lining layer out here farther, you can see it gets thicker out here. And this is definitely some soft plaque out here in this artery. Here's another example of some soft plaque in a different artery. And so the question is then, what does finding that mild asymptomatic blockage mean? We know that 86% of the time it's those milder blockages that are going to cause trouble. So let's look at that. So here's a study where they took 10,000 healthy people. Nobody had high blood pressure, diabetes, or cholesterol. There were men and women in the study, ages 35 to 65 years old. Everybody got a baseline carotid and femoral artery scan. Nobody got any treatment for 10 years because this was a natural history study. They wanted to see what happens if we don't treat arterial disease. So the average Framingham risk score, the risk for the 35-year-old men and women would be about 1.5%. The 65-year-old women would be about 5%. The 65-year-old men, 10%. The average Framingham risk in this entire group was about 3, 4, 5%. And here's the baseline pictures they got. There were almost 8,000 people who had normal arteries. There were 930 people that had thickening of the lining, but not plaque. There was another smaller group, 611, who had plaque, even though, surprisingly, it was surprising because they did not have high blood pressure, diabetes, or cholesterol. And there was a small group that had what they called stenotic plaque in this group, which was a 50% or more blockage. So what happens? So now we're going to follow these people for 10 years. Nobody gets any treatment. And here's what we see. If you had no blockages, you had normal arteries, nothing happens to you. 1 person out of 8,000 had an event. If you had thickening of the lining, but not plaque, now the risk goes up to almost 9%. So you remember that was a 3.3 to 5% risk in entire group. So it doubled or tripled your risk of having an event. And if we found plaque in somebody who had no high blood pressure, diabetes, or cholesterol, then it was a 40% event rate, not 3, 4, 5%, or even take the worst case, it was if they were all men in this group that were 65 years old, they would have a 10% risk, but no, it went up to a 40% risk. So now that we have found mild asymptomatic disease, what are we going to do? How are we going to treat that? Well, we know it's inflammation that drives that whole arterial disease process. It's inflammation that plays a key role in the development of the plaques and progression of the atherosclerotic disease. It's inflammation that destabilizes those plaques and promotes blood clot formation and plaque rupture. And so the next question obviously is, are my arteries inflamed? And we have several tests that we do on our patients routinely to look and see if their arteries are inflamed. And if they are, we're going to get on that. So by finding root causes, what are the whole bunch of things that can drive the whole inflammation process, and optimally treating them, we can get that inflammation, that fire in the arterial wall to resolve. And so here are all the root causes that we look at, things like obstructive sleep apnea, low vitamin D, and inflammatory diseases, autoimmune diseases like rheumatoid arthritis and Sjogren's disease, lupus, insulin resistance. I told you, 100 million people in this country are insulin resistant and don't even know it. And then there's the dental problems, the periodontal disease and endodontic disease. And that's why my wife and I are practicing together, because while I'm responsible for all these things, she's responsible for finding and treating these, because I can't do it. That's not what I was trained in. And then if we find all these things, treat them all optimally, then everything goes back towards normal. If you've got soft plaque in your artery, it shrinks down and calcifies and stabilizes. If you just have a thickened lining that's inflamed, that can go back towards normal. It can go back to being a normal lining. So we can actually stop the process and reverse it. And so there was a great study that came out in Circulation, American Heart Association Journal back in 2013 that said there's a direct connection between oral pathogens, the bacteria in your mouth, both periodontal and endodontic, that's root canal lesions, and acute heart attacks. So how are we going to treat all this? Well, lifestyle modification is the cornerstone of therapy. We cannot outprescribe lifestyle. Okay, that's the most important thing I have to get my patients to do is make some changes in their lifestyle to help get that inflammation down. We want you to help take healthy back. So here's the American Heart Association 7 essentials for heart health, and they're all very reasonable. It's not smoking, is having a BMI under 25. BMI is body mass index. If you don't know what yours is, it's based on your height and your weight, and you can Google what the calculation comes out to. A normal BMI is 19 to 25. Over 25 is considered, over 25 to 30 is considered overweight, and over 30 is considered obese. 150 minutes of moderate or 75 minutes of vigorous exercise per week, a total cholesterol under 200, blood pressure under 120 over 80, fasting blood sugar under 100, and then diet. And at least 4 of these, so getting more fish in your diet, cutting back on red meat, increase fiber and whole grains in your diet. And this is the one that I think people have the most trouble with, and one of the more important things, and that's that 4 1/2 cups servings a day of fruit and vegetables. And if you ask most people, well, are you getting that? Well, yeah. For lunch, I had a salad for lunch, and it had, a couple carrot strips in it. There was a couple slices of tomato and a slice of cucumber. And for dinner, I had broccoli. Well, that's just not adequate. You're not getting what you need. And so we strongly encourage our patients to use a Juice Plus enhanced diet. Juice Plus is just freeze-dried fruits and vegetables. They're vine ripened. Today, part of the problem with our fruits and vegetables, they've lost a lot of their nutrient content compared to 30, 40, 50 years ago. There's been a loss of a lot of nutrition because of loss of the fertility of the soil, because things are not picked vine ripened. We get our fruits and vegetables from all over the country, all over the world now. So they have to be picked before they're ripe so that they can survive the trip to wherever you live to get them. So it's really more like 7 to 13 servings of fruits and vegetables a day. There's, the quality of food is decreasing. There's, trans fats, there's pesticides, GMOs, synthetic vitamins, there's artificial coloring, growth hormones, antibiotics in the food. And so it's harder to get a good quality food. And it's so important for us because fruits and vegetables is where we get our antioxidants from. And while we are, so what are antioxidants? Antioxidants are things that can combat the free radicals that are occurring or we're putting in our body all day long. While we're just living and metabolizing everything we do, we're creating oxidative stress for our body. What that means is free radicals are molecules that have lost 1 or 2 electrons and they become very reactive. And so the antioxidants are molecules that have an extra electron or 2 to give up and can stabilize those free radicals. And those free radicals, when they're floating around, they react with all sorts of things, including your DNA, and it can play a role in aging. So Juice Plus for us is, we highly recommend it to all of our patients because it gets them 30 fresh fruits and vegetables every day. And it's easy to take, it's not expensive. And it's a great way to make sure that you're getting that one of those important parts of that lifestyle modification. There's hundreds and hundreds of phytonutrients in fruits and vegetables, as opposed to just taking a multivitamin, which, by the way, taking multivitamins has no beneficial effect to cardiovascular disease. It'll decrease your risk of cancer a little bit, but you may get 6, 8, 10 vitamins in a multivitamin, nothing like the nutrients you get out of fresh fruits and vegetables. And the real reason we back fruit Juice Plus in our practice is because there are 39 randomized, placebo-controlled, double-blind studies done in major universities all over the world, published in peer-reviewed journals like JACC, which is my journal. That's the American College of Cardiology journal. The Clinical Journal of Periodontology and Nutrition Research, and all these peer-reviewed journals, which say that Juice Plus is beneficial in a multitude of ways. And for me, it improves cardiovascular wellness, it decreases inflammation, improves the immune system, keeps you from attacking your DNA. For my wife, for Barb, it improves gum tissue. It decreases bleeding, it decreases pocket depth, so you don't have someplace for those bacteria to grow in your mouth. It improves insulin resistance and decreases abdominal fat mass, which is a risk for cardiovascular disease. So we love Juice Plus. And just a couple examples of some Juice Plus articles, studies that say it's beneficial for you. This first one published in the British Journal of Nutrition, which is talking about giving people Juice Plus for 8 weeks, and then looking at measures of oxidative stress, and that's the carboxy proteins and oxidative LDL, oxidized LDL. That's the LDL that's reactive and gets into the intima and causes trouble. TNF alpha, that's a tumor necrosis factor alpha, interleukin-6. These are both inflammatory cytokines. Cytokines are little signaling proteins that tell your body to do something. In this case, it's telling your body to mount an inflammatory response. And they also looked at the capillary blood flow before and after Juice Plus, and with and without exercise. And what they found was taking Juice Plus decreased oxidative stress, it decreased these carboxy proteins, it decreased oxidized LDL, decreased tumor necrosis factor alpha, and improved blood flow. Exercise and Juice Plus together independently, each also include capillary circulation. So it does all the right things for inflammation and for oxidative stress. This other article was published in the Journal of American College of Cardiology, talking about the effect of Juice Plus on, now it gets a little complicated. I'm going to explain it to you, okay? Impairment of flow-mediated brachial artery basal activity. So here's what they're talking about. We know that if you eat a high-fat meal, it's going to decrease your artery's ability to constrict and relax for the next 4 hours. And so what they did in this study was they took a bunch of people and put half of them on Juice Plus, half of them on placebo, and they looked at this flow-mediated brachial artery dilatation. This is a simple test where they just put a blood pressure cuff on your arm, leave it blown up for a while, let the blood pressure cuff down, and they look at what's called the hyperemia, which means the increased response of your blood vessels to having been hypoxic for a little while, for having not gotten enough blood flow. And so your body over responds to that. And that's measured just by using an ultrasound. And so what they found was this flow-mediated brachial artery dilatation measured before and after that meal showed that Juice Plus blunted the high-fat meal's ability to block that vasoreactivity. So this is a measure of endothelial function, because as you remember, I mentioned at the beginning that the endothelium produces nitric oxide, which is what makes your blood vessels dilate and get larger. So so Juice Plus helps with endothelial function. That's huge. So this is, all these things are important parts of lifestyle. It's really the most important thing I counsel my patients on is lifestyle. So what do you look like the day before you have a heart attack or stroke? Well, you know, you don't plan that you're going to have a heart attack or stroke. Nobody wakes up in the morning and says, I'm going to have a heart attack today. I better be looking good because I'm going to the hospital. No, you're just doing the usual daily activities. You're with your friends and family. You're shopping. You're walking the dog. You're enjoying life. If you were David Letterman, you were getting ready to record the next show of the Tonight Show. If you were James Gandolfini, you were working on the next episode of Sopranos. John Candy was probably planning his next big movie. Bob Harper was exercising in the gym. He was riding on an exercise bike and fell over dead and got resuscitated by two family practice doctors who happened to be in the gym at the same time. And John Warner, as you recall, dropped dead from a heart attack in his hotel room, got resuscitated by his daughter and a couple of and a pediatric cardiologist who was down the hall. And I think the most important thing about John Warner's story is that after he recovered from his heart attack and was giving interviews to all the major news outlets, CBS, NBC, CNN, he said that he knew that he was preordained or destined to have a heart attack because when his first child was born, he looked around the room and all of his family members who were there to welcome his first child into the world, and he noticed that there was not a single male member from his side of the family over the age of 60. So he thought that he was destined to have a heart attack. Unfortunately, what he didn't know is that heart attacks are optional. So, and here's another classic example of Tim Russert, who you all probably remember from the NBC Sunday morning political talk show, Meet the Press. He had high blood pressure and high cholesterol. He was being treated for both of them. There was that standard of care goal for both of these. He was on an 81 milligram aspirin appropriately. And he had just passed a normal stress test. And now you know that if you pass a stress test, all that tells you is you don't have a blockage that's 70% or more. You can have one of those milder blockages, and so many times that milder blockage is what causes a heart attack or stroke. Then, after passing a stress test with flying colors, he dropped dead of a heart attack at the NBC studios just 8 weeks later. He was only 58 years old. So what's our take home today? What did you learn? Inflammation is what drives the arterial disease process. The key to prevention of arterial disease is finding mild, asymptomatic disease rather than waiting until you have symptoms or an abnormal stress test. Working with a complete health dentist like my wife, Dr. McClatchy, who understands the oral systemic connection, is paramount to finding all the sources of inflammation to optimally treat. And lifestyle modification is huge in what we do. And that includes a Juice Plus enhanced diet, which is critical to decreasing inflammation and oxidative stress to help slow, stop, and even reverse the arterial disease process and thus prevent heart attacks and strokes. And so now you know heart attacks are optional. And if you know that, then you know what Maya Angelou says, which is do the best you can until you know better. Then when you know better, do better. So please join us in our mission to help knock cardiovascular disease off that top rung as the leading killer in this country.
What I need to do? Can you share again? Elaine?
You have to stop sharing first.
I do that.
You just hit the green button at the bottom and to stop share.
That one?
No, at the bottom of your screen.
This one?
The one that you hit to share your screen, you hit it again.
Okay, I'm trying. Stop share. There, sorry. There we go.